21. In 1 year's time, you're going to be singing 22. Taylor Swift, yeah.
So I'm Justin Varney. I'm the Director of Public Health. That means that my job is to protect and improve the health and well-being of the people that live in Birmingham.
Bid Central. Yo, what's up, guys? It's your boy in the Bid Central, and I'm in Birmingham City Centre right now, asking the youth, 16 to 25-year-olds, about what their views are on the COVID vaccine, COVID itself, and whether they'll be taking the vaccine. This one's going to be a sick video, guys. It's a collaboration and sponsored by Birmingham City Council. Let's see what's going to happen. The first part of the video is going to be where I'm going to interview the youth. The second part of this video is where I'm going to sit down with a senior public health official and ask him all about what's happening right now, especially with the vaccine. Let's do this! Yes, guys, I am here with
Izzy and Tilly.
Amazing, Izzy and Tilly. How old are you guys?
I'm 21.
Amazing.
Same.
21. In 1 year's time, you're going to be singing 22. Taylor Swift, yeah. But anyways, guys, super quick. I'm going to ask you some quick questions, right, about the COVID vaccine and COVID, right?
Yeah.
Guys, what are your views on COVID?
It's awful. Like, obviously, it's a pandemic, but it's really serious and stuff. Like, yeah.
Amazing. How about yourself?
Get vaccinated.
Okay, you mentioned the vaccine straight away. Okay, that's very interesting. Have you taken the vaccine today?
Yeah.
Amazing. And how did it feel?
I didn't feel it get in. I was tired for like a day, but yeah.
You've only had one yet, Tilly, yeah?
I only had one, yeah.
And you're planning to get the second one soon?
Yeah, when I can.
Okay, amazing. Did you have any fears before you took the vaccine or anything like that? Or?
No, because I've already had COVID, so
Okay.
yeah.
Amazing. So you survived COVID and got the vaccine, yeah?
Yeah.
Amazing. How about you?
Yeah, I'm double vaccinated, and I also had COVID like in the first week of the initial lockdown when COVID first happened in March 2020.
Amazing. And did you guys have any fears at all? Like, especially you now, because you said you never had no fears about the vaccine, right? Did you have any fears at all about the vaccine?
No, not at all. I think like if you look it up correctly on the internet, like it's very easy to find the right information, and
Propaganda about it,
Yeah,
but it's nothing. None of it's like true. So yeah.
I think you have to be quite. I think it's quite easy to find the right information. You're quite logical, and if you're just smart about it, you can figure out what's fake and what's not. Like use trusted sources, use a government website, like look up actual papers about it, and like you can really quite quickly debunk the myths. So like I didn't have any fears at all.
Amazing. So you will be probably getting a second vaccine and probably going on holiday, right?
Yeah.
Are you going to go anywhere? Have you planned any holiday? Are you thinking about anywhere? Are we thinking?
I'm going on holiday next week,
Where are you going?
Portugal.
Amazing! You know what? I'm a big fan of Ronaldo. You know that? Like Cristiano Ronaldo. I think he is an amazing person. He's a good-looking guy. He does amazing things. He does charitable work, and he's the best at what he does.
Yeah.
She's gonna have a beautiful tan. You already got a nice tan already, so yeah.
Thank you.
You're welcome. And how about yourself? You going anywhere?
No. Well, as soon as I can, I probably will, but nothing got planned.
Maybe Portugal if she recommends
Portugal, yeah.
Amazing.
I'll see how it feels.
Amazing. Yes, guys, I've taken my shades off because I needed to obviously be able to look at people because the shade's coming down, yeah? But basically, guys, I am here with
Spencer,
yes, big Spencer. How old are you?
20.
20. You look amazing, bro. I'm liking the tan. I'm looking a bit like Leonardo DiCaprio right now, the blue eyes, he's got the tan.
Wow, what can I say?
Guy, but listen, super quick, bro. I know you've got things to do right now. You're just shopping out today and stuff, yeah?
Yeah, just been shopping.
Okay, amazing. So what's your views on COVID at the moment?
It's one of them. The government's just got to stick to whatever they've chose to do and just got to go by a plan, because that's what I do when I coach in football. Stick to a plan.
So, in terms of the vaccine, right, have you got any views on the COVID vaccine, like right now?
Not really. I mean, I'm not refusing to have it. I've had both my vaccines.
You've had both your vaccines?
Yeah, I've had both my vaccines because I want to go on holiday, or I'm 20, I want to live my life, so I've had them both. Amazing.
And what do you think, like, in terms of, before you took the vaccine, did you have any fears in relation to the vaccine, or, do you have any friends who've got any fears? Like, what kind of views are you hearing, or did you have yourself?
I had an uncle, actually, who had a fear of it, but he's scared of most things. So other than that, I just really live my life and just go on what's what. And if anything bad happened, it happened, but you got to live your life every day, so do whatever you think's right.
Amazing. I am here with
Yusuf.
Yusuf, lovely to meet you. How old are you, bro?
I'm 17.
Amazing. And what do you do?
I go college.
So, Yusuf, what are your views on COVID at the moment?
I think it's getting better because of the vaccine, so I don't think there's going to be another lockdown. But obviously, there needs to be herd immunity for everyone to, reduce the cases so they stop increasing. But yeah, that's what I think about it.
It's interesting you said that because I don't know if you saw, but on the news they're mentioning if the cases keep rising, there might actually be a lockdown. We don't know if it's not. Obviously, we're recording this in September right now, but they said in October, potentially. What's your views on that? Do you think that there is, so you don't think there's going to be a likelihood or?
No, I don't think so. I think if everyone gets vaccinated, then I don't think that there would be another lockdown because it wouldn't spread as much, you know.
Amazing. So you're for the vaccine, right?
Yeah, obviously.
Okay, so have you taken the vaccine?
No, I'm going to take it tomorrow. Actually, not tomorrow, but there's a date. It's like from 11 to 12 September. I have to go somewhere, and that's when I'm going to get the vaccine.
Amazing. And do you feel confident with the vaccine, or did you have any point where you weren't confident about the vaccine and you thought it was unsafe like a lot of people?
Yeah, I did think it was a bit unsafe at first because, there was a bit of controversy going around with the, I don't know, it gives problems and stuff like that, but I'm past that, I guess.
What changed your views?
I don't know, I just did more research into it, I guess, yeah.
Amazing! Okay, bro, I really appreciate you taking your time to be in this video. We are here with...
Georgie.
Georgie! What a lovely name, Georgie.
Thank you.
You're welcome. So how old are you, Georgie?
I'm 24.
Amazing! And what are you doing in town today?
Shopping.
Shopping. Getting anything nice? What are you getting me today?
Well, I wanted to get a nice rug, but the one I wanted sold out, so...
Oh my god, you're getting me a rug!
Yeah, I want a rug.
You're getting me a rug?
I'm not getting you a rug. For my room.
Amazing! Okay, cool. Okay, listen, Georgie. I know you've got things to do, you're shopping and stuff, yeah? What is your views on COVID at the moment?
I think it's it's a real bad disease, but I think it's the wrong disease to have all these measures. There are diseases out there which have got 50% mortality, and this one is 1 in 10,000. It's the wrong disease to have all this waste of money and plastic and scares, really. I think there are worse diseases out there, and they're going to come, and we're going to realise that COVID was nothing in the end.
Interesting. Okay, I like your insight. You sound quite educated. Do you study or something, or did you study anything?
I'm actually a doctor.
Wow, we actually met someone who wants to be a doctor someday, and I've met a doctor.
Well, I'm not a doctor, human doctor. I'm a doctor of veterinary medicine. So,
So you're a vet?
Yeah.
Sick. I guess you've got the beauty and the brains, yeah?
Thank you so much.
You're welcome. You're welcome. Okay, so super quick, right? Have you taken the vaccine?
Yeah, I've got both doses.
You've had both doses?
Yeah. Yeah, I'm
She's
done. I'm
taking
double
it.
jabbed.
Double jabbed. And what were your views initially about the vaccine? Because a lot of people, I think now people are starting to become a bit more yeah, it's okay, but in the past people are a bit scared. Did you ever have a point where you were scared about it, or?
Nah, to be honest with you, I feel I don't know, 24 years old, people do a lot of crazy stuff. They do stuff at the weekend. Why they're so worried about a vaccine, which has had so much research into it, but they're not concerned about what they take at the weekend.
Interesting. I'm happy we met someone like you because, we're going to be interviewing a senior public health official as well, right? It's going to be collaborating in the video, but I weren't expecting someone to be in the medical field who's giving this insight as well.
Yeah. Yeah, no, there was so much research done into the vaccine. If anything did go wrong, if there was any adverse reaction that caused, affected a lot of people, they'd be absolutely screwed. So they had to make sure they got it right, otherwise they never would have offered it to us, otherwise they would have just looked really stupid. So, no, I had no fears about the vaccines.
Amazing! Yes, guys, that is the first part of the video so far. I'm actually happy, right, and amazed at the responses we got today, guys. We had some super pleasant people, and I think that we've realized that a lot of people were quite positive about the vaccine, which I weren't expecting, right? But right now, I know some of you guys are concerned about the vaccine. I know a lot of people actually aren't sort of familiar with what the vaccine is all about and etc. And some of you are concerned about COVID. So what we're going to be doing right now is, the next part of the video is going to be interviewing, or sitting down with a senior public health official and speaking to them about the vaccine, what it entails, and what's happening with all this COVID stuff at the moment, guys, right? So yes, let's go and do this! So yes, guys, I hope you enjoyed the first part of this video. I am super excited right now because I'm in the presence of an absolutely amazing individual. This individual not only went to medical school to initially become a GP, but then realized that his main focus in life and aim and objective was to help make the world a better place. And that's why he went on and further studied even more and is now the Director of Public Health for Birmingham City Council. Without further ado, I'm going to present to you Dr. Justin. How you doing, sir? You right?
Good to meet you.
It's an absolute pleasure to have you here today. I'm feeling a little bit nervous right now. So I'm just curious if you tell us a little bit about yourself and, your field right now and what you do.
Sure. So I'm Justin Varney. I'm the Director of Public Health. That means that my job is to protect and improve the health and well-being of the people that live in Birmingham. So we have about 1.2 million people, and that ranges from commissioning sexual health services to running campaigns on physical activity to funding our drug and alcohol services as well. And in normal times, a tiny little bit of my job is doing things like measles and mumps and vaccination. And then this thing COVID came along last year, and it's pretty much consumed my life for much of the last year.
I'm sure it has, not only yours, but everyone out there, right? It's been a crazy year indeed. I know that's the reason why we've got you here today, Dr. Justin, because I think there's a lot of people out there who are actually quite concerned about COVID, not only just COVID, but the vaccine itself, right? In terms of the video we did with the public, we had some positive responses, but I'm sure you're aware yourself that, there's a lot of people, especially the youth, who are concerned about the vaccine and potentially don't really want to take the vaccine, right? So, firstly, I'd like you to just tell us about how COVID has affected Birmingham as a city and what's happening right now with it.
Yeah. So we've had over 150,000 cases confirmed of COVID during the pandemic. And when you look at Birmingham on paper, we have a younger population, more of our population work in health and social care, more of us work in restaurants, in schools, jobs that you couldn't do from home. We also have lots of people that don't live in great houses, that are overcrowded. And all of that added to the fact that coming into the pandemic, we had a 10-year gap in life expectancy in the city. So our health was pretty bad before this started. All of that set us up to fail when COVID arrived. So the fact that we've got through this with only 3,000 deaths is pretty good. I wish it was lower, but 3,000 is much better than what was predicted at the start, which was over 9,000 deaths. So it's been a rough ride. Lots of communities have been hit really hard because of the lives that they lead, the jobs they do, the environment they live in, and the health they had coming into COVID. But overall, the city's come together and we've weathered it pretty well.
Amazing. And that's thanks to people like yourself who've actually been, working with others to do extensive research into how we can actually help the community, right? Because every sort of area and every city, in terms of the public health officials who are involved, do help make that impact. Does that make sense?
It does, but this is a city effort. This is Team Birmingham. I mean, from my point of view, I'm just one part of the system. What's been amazing is, before the first lockdown, I sat down with the mosques of the city and they all came together. People who would not sit around the same table before came together. And I remember we met in Central Mosque 2 weeks before the lockdown and talked about, should Friday prayers stop? Should we move online faster because case rates were rising fast? And after that meeting, the mosque did start to change ahead of the national guidelines because it was in the best interest of the congregation. We've had imams who've hosted vaccine pop-ups in mosques. We've had gurdwaras that have been doing vaccination. Black church leaders who stepped in front of a congregation who was very nervous and said, look, this is the right thing to do. So it's about people like that coming together in communities. It's about young people who've been passing the truth and not passing rubbish. The campaign we did with Beat Freaks on Pass the Truth, so much rubbish out there on the internet, and people pass it on because they go, oh, this is kind of funny, this is, the problem is that for every one of us that think, oh, this is just an idiot saying something and dressing up as science, someone might listen to it and think it's the truth, and that will stop them doing the right thing to protect themselves and their families. So this has really been about Birmingham, all our communities coming together, and my job and the job of the council has been about giving people like you the information so you can make your own decision. I'm not going to judge you for the decision you make. I want to make sure you make it with the facts and the right information, not because you've listened to some idiot on YouTube telling you a bit of pseudoscience.
Amazing. So in terms of the vaccine, right, because that's the concern, isn't it? That's what we're talking about. In terms of the rubbish that's put out there, it's not just in terms of what COVID is, it's about what the vaccine is, right? You know, we hear all sorts. We've heard 5G, and we've heard about the vaccine being something that if you take it, it's going to kill you, and, you know, they're going to control you or put a chip inside you and it's going to track you wherever you're going. You know, what would you say in terms of, what would your response be to that, and what is the vaccine exactly?
A vaccine is really trying to give your body exposure to usually a bit of the virus. It's not the whole thing, it's not alive, it's a bit of it, and it's enough so that we recognise that and we can build a special response force to attack it. And that's kind of how vaccines work. Same's true for the COVID vaccine. It's a bit of the coat of the virus wears. It's not the whole virus. It can't give you COVID, can't make you manufacture COVID, just makes you, in some cases, it gives you the instruction sheet to make the coat. In other cases, it gives you a bit of the coat itself. And you learn to recognise it, develop antibodies, and the antibodies attack.
Amazing. And in terms of this vaccine, right, you know, obviously people are concerned and in terms of it having side effects and stuff like that, right? So, you know, having explained what a vaccine is and how it can protect you, in terms of the COVID vaccine, would you say there are any side effects? And if so, what are they? And
Sure.
If not, why do you think people believe that they may be?
Okay, so every medicine has side effects.
Okay.
You know when you open a packet of paracetamol and there's that leaflet falls out that everyone just chucks in the bin and doesn't read? If you actually open it up, that's the list of side effects. So every medicine has side effects, and the same is true for vaccines. When they come in the packet, same leaflet describes all the side effects. The most common side effects that people get with vaccines are you get a sore arm where you got injected. With the COVID vaccines, generally you feel a bit fluey the day after, and that's because your body's doing the test. You know, it's a bit like none of us like to sit our exams. We always feel a bit rubbish about it. Same's true with the vaccine. You're sitting an exam and your body's reacting, going, I don't like this, but I'm doing the learning anyway. And then that goes away. All medicines have really rare side effects, and the same, and all vaccines too. So whether it's MMR or whether it's your TB, BCG, TB jab, or it's COVID, there are some super rare ones. And the one with the COVID vaccine that everyone talks about is blood clots. So because the vaccine works by teaching you to make the protein that sits on the outside of the virus, think of it the button on the coat. That's the bit that you're taught how to make and then your body responds to. That button seems to do something that makes our blood really sticky in rare situations, and that can give a particular type of blood clots. Now, about 1 to 2 in a million people who have the COVID vaccine get that kind of blood clot. In comparison, if you take 1 million smokers, about 16,000 will get a serious blood clot like this. If you take 1 million people who catch COVID, about 170,000 of the people who catch COVID will get this serious blood clot. So yes, it's a risk, but it's less risky than driving from Birmingham to London. You're more likely to be killed in a car if you drive from Birmingham to London than you are to get a blood clot with the vaccine. But also, if you put it in comparison to catching COVID itself, actually, it's over 100,000 times more likely you'll get a blood clot that's serious from COVID than you will from having the jab.
Interesting. And where can people learn more about the vaccine? Like, are there any websites or, you know, apart from just this video which they're seeing?
Yeah.
Like, obviously, you being a doctor, you might know.
Sure. So it's really important you look at trusted places.
Okay.
So for the number of times people have asked me or sent me some WhatsApp video they got off their mates of some bloke in his garage in Idaho, and they go, "What does this mean? This must be true." And I'm like, "Look, he's recording it in a garage in Idaho. This is not world-class science." So go to the places that trust. You know, the NHS have really good vaccine information on their website. our government, surprisingly you might say, has been super transparent. So if you want to go back and look at the research that's been done, it's all on the government website under what's called the JCVI, so the Joint Committee for Vaccine and Immunisation. All of their minutes of their meetings are published. All of the research is there. So if you want to go back and look at the actual research studies themselves, you can. I mean, that's how open everyone's being. But please go to the trusted sources. You know, when we're sick, we go and ask a doctor for help. We don't go ask a bloke on the internet. So why would this be any different with COVID?
Exactly. I think there's a lot of sort of conspiracies out there in relation to this, and people making up their own things, and then they're gaining a bit of a following. And I think that's what it relates to as well, because I think in a social media age, people might make a video and they realize they get a response from it, and then they're like, whoa, hold up, people actually, and then they start believing that, like for example, someone like you with a medical degree and then like 10 years of extensive research, right, to become a director of public health, for example, right, you know, in comparison to someone who, I don't know, maybe smokes all day and sits in the room and has watched a few YouTube videos or watched that 70s show or something, yeah, or that science show that is the Big Bang Theory, right? And now they think they know everything. I think there's a massive difference, and people need to realize that. You know, what would you say, yeah, to the youth in terms of what is the importance of this vaccine to them in itself?
So, I mean, all the way through the pandemic, we've said the younger you are, the less likely you are to get really sick from COVID. And that's still true. I mean, COVID's not changed a lot in terms of how sick it makes you. It's changed in terms of it becoming more infectious. And with each of the new variants, we're on to Delta and Mu now, that you're more likely to catch it than you were with the first version. But it's still just as dangerous. It's just as likely to put you in hospital. So someone who's 80 is about 300 times more likely to end up in hospital than someone who's 18. But that doesn't mean someone who's 18 can't end up in hospital. So COVID is still a risk to you as a person. The other thing we're seeing is long COVID is quite important for young people. So there are some signs that young people do get long COVID, that the symptoms they get, particularly the fatigue, the exhaustion, can last up to 12 months or longer after the first infection. So you take the vaccine because we know it stops you getting seriously unwell. It reduces the chance that you can pass it on. So if you're vaccinated, it's between 60 and 40% reduction. You might still catch COVID and it'll be a mild illness, but you're much less likely to give it someone that you live with and that you care about. And the third is there's emerging evidence which suggests that if you're vaccinated, your chance of getting long COVID are also massively reduced as well. So for the sake of 2 injections, I'd take it. I have taken it. Everyone I know and care about is taking it. It's better to be protected and safe than take your risk with COVID, because you might be the unfortunate person that does end up in their 20s in intensive care or dying of it. We have seen people who are young get killed. We have seen them in intensive care. Why take the risk?
Awesome. And you know, there was something I was thinking about, and I think you've covered it really, but at the same time, I haven't asked you directly. So in terms of the vaccine, right? So a lot of people have this concern. Me personally, right? Okay, so look, I haven't taken the vaccine yet, but now from speaking to you right now, it's starting to make more sense, right? Yeah. So I'm like in a position where I was thinking, and I got asked by I was actually on the news, you know, for BBC as well, right? Where I said, look, how can we be so sure as to a vaccine which basically was made so quickly, right, in terms of the time period, because usually vaccines might take a few years, etc., right? So how can we be so sure as to the vaccine being so effective, right? Within in relation to the time frame it was created or developed in, yeah?
So vaccines follow a really set process, right? So it's set out internationally, we follow it in the UK. Every country in the world follows the same steps to make a vaccine. So you start in a test tube, then you move to animal studies, then you move to 3 stages of human studies to look at, is it safe? Does it work? Does it produce the teaching we want it to? And then does it do that in different types of people? So at different ages, different ethnicities. And then you take all of that research data, it goes to an independent regulator who looks at the original data, not just the fancy write-up. They look at the raw data and they say the vaccine's safe, it does what it says it should, and these are the people it should be used with, and they make the recommendation. And then once the vaccine rolls out, in most countries we have what's called a yellow card system. So if people still have side effects, they're reported into the regulator, and the regulator watches them and keeps a log of them. And that's how we learnt about the clotting risk factor. It's a really rare side effect, so I as a doctor might vaccinate 1,000 people and never see that side effect. But because of the yellow card system, we found it because we keep looking for them. What was different so normally you're right, it would take a long time. It takes a long time because you've got to raise money. So these things are really expensive. All the research trials, all the scientists, you've got to pay for them. So you've got to raise money at every single step of the process. 2, at each stage of the research process, you have to go to what's called an ethics committee and get them to approve it before you can move forward. And then the third is, when you're doing the research trials, you need to do it when the disease is out there. So you've got, particularly in that third stage of the trial, where you're testing how it works in different people, in real life, you need to be kind of in a place where the disease is quite common. So in COVID, loads of money. The World Bank just basically said, here's a blank check, get on and find us a vaccine. The committees, those ethics committees, normally would meet at fixed points during the year. So if you came to me and you said, I've just done my first stage animal trial, I want to move to humans, I'd go, I'm really sorry mate, meeting was last week, the next one's not for 6 months, you've got to wait. In COVID, those meetings were called when they were needed. So instead I'd say, actually we'll bring it together next week, submit your data. So that moved much faster. And then the third bit in the trials was COVID was everywhere. You didn't have to wait for COVID season to come. So actually you could do trials, and they were also doing trials in different countries at the same time. So one of the great things we know about the COVID vaccine is this is one of the first vaccines where we've had really large numbers of people from different ethnicities in the trials. There were lots of people in Africa who took part, lots of people in South America, lots of people in India, lots of people in Europe. So it was trialled in pretty much every ethnic type going, and we know it works. So that's why it all moved faster. It's a bit like trying to drive from Rednall to Sutton Coldfield. In normal times you've got roadworks, the traffic lights go red, you've got to wait. In COVID times it was green lights all the way, and there were no roadworks on the road.
Interesting. I think with the youth, an analogy that could resonate with them is when you go to a theme park, for example, right? You've got two options. You either get fast track, bam, right, or you have to wait in that queue for like 2-3 hours. I think it's the same kind of thing, and I think that makes sense. So I think people actually, even like myself, what I thought was that usually vaccines take long because you have to, put them in a lab and they have to stay there, etc., freeze them, God knows what, right, watering a plant. But what you just said right now is, it's actually the meetings which take place, and all this sort of background work that has to go on, right, to create or test whatever it is, and that's why it takes so long. But if you didn't have to do all that, basically the COVID vaccine has had a VIP, basically.
And the bit on that one is, if you think about when you do the fast track pass, right, they still do the safety check before you get in the roller coaster. All the health and safety is still there. You just can't see it. You're moving through it faster. And that's the same in COVID. All the safety stuff was still there. They just had a fast track, so it moved a bit faster.
Amazing. And, before we finish off, would you have any final sort of message for anyone out there, or any of the youth especially, in terms of the vaccine and taking the vaccine and what they could do?
Yeah, I suppose 2 things. One, go read the stuff. Like, don't listen to your mates. Don't listen, much respect to Naveed, but, don't listen to blokes on the internet. go look it up yourself, make an informed decision, and make the decision that's right for you and your family. And when you look at who's spreading some of this fake news, some of it's spread by like far right groups who really want to damage some of our ethnic communities and some of our young people. They want to make you scared. So go read the stuff yourself, right? And if you don't understand it and it's too complicated science, you didn't do well in biology at school, ask someone. You know, go ask your pharmacist, go ask your GP, ask your practice nurse. You'd ask them if you broke your leg. This is no different. So my big ask is go look it up for yourself and make an informed decision. And don't just do it because Naveed and I tell you to. Go do the research yourself and put the time into making a decision that's the right one for you.
Amazing, Dr. Justin. It's been an absolute pleasure. Guys, I just wanted to say a massive shout out and appreciation to Birmingham City Council for basically sponsoring this video, reaching out to me and asking me to do this. It means a lot. If you've been watching my content, you've seen how much I've been growing, guys. From the food videos to the public questions, everything I've done. This today, guys, is something very different. You're seeing me in more of a serious light. I'm not just entertaining right now. I'm not dancing or anything like that. This is something where you're seeing my me having a law degree coming out here, right? Yeah, because a lot of my followers know I've got a law degree, but I decided not to pursue it because I wanted to become an entertainer. And this is something. So if you ever have anything else that you'd like me to do, for example, guys, do let me know. Make sure you like the video, comment, share with all your friends, any family members that need to see this, guys. And you know what I'm going to finish it with, guys? Naveed Central. Peace and love.
Naveed Central.